Okay, is this everybody? Let's go ahead and get started, okay? First things first, new changes with the COVID policy. If you have to quarantine or stay home sick with COVID, then you have to use your own PTO. They're not covering it anymore. Also, they're encouraging that if you do test positive at home, just come on in and don't tell anybody. Okay, the new policy is called, if your symptoms don't show, save your PTO. Thank you. We are no longer doing our interdisciplinary meetings over the phone. We have to come in now, and we can thank Janet for that because she can't figure out how to mute the phone. It's basically 20 minutes of hearing her sniff and clear her throat and talk to her birds. Thank you. Okay, so it's really hot in here. I know that. That's because they still have the heaters on, and it's like 70 degrees outside. Turns out these thermostats don't work. They don't do anything. But if you get too hot, just go to 413 because it's always freezing in there because of the ghosts. Thank you. Let's go to the suggestion box. This one says, remember, if you don't document it, then it never happened. And that includes all the stuff that you steal from the supply closet. That's true. All right, well, you guys have a great shift. Just remember, we don't have any doctors or practitioners here tonight, so if there's an emergency, just call 911. Okay, is this everybody? Let's go ahead and get started. First things first. Remember, we have to approve our own time cards now, which is ridiculous. So we have to get our time cards approved by midnight tonight or else we might not get paid. We'll see about that. Okay, thank you. I don't know if you guys heard, but about 4 or 5 hours ago, we actually lost Miss Jism. Yeah. It took us a couple hours, but we found her. She was across the street over at Whataburger. She's just double fisting patty melts. It's crazy. Thank you. Let's see. Janet's birthday is coming up, and we're all going to throw in together, and we're going to get her a pair of those shoes that squeak so loud so we can tell when she's coming around the corner. Because we could not get her to keep that bell on. Thank you. Let's go ahead and go to the suggestion box. Okay, this says, if you guys don't quit making fun of my name, I'm going to quit Mike. Oh, that's my fault. See, his name was Mike Sweeney, and I kept calling him and saying, hey, I'm trying to get a hold of Mike Sweeney. Yeah, it's really hard to get a hold of Mike Sweeney. And I'd say, hey, I need to see Mike Sweeney up at the nurse's station immediately. He quit like 2 weeks ago. I guess we'll never see Mike Sweeney again. All right, well, you guys have a great shift. Just know we are down to one keyboard. Okay, is this everybody? Let's go ahead and get started, okay? First things first, HCAP scores. So the patient satisfaction surveys are back, and we got about 20th percentile across the board, okay? Which is great, guys. We haven't been this high in like 4 years. Keep up the good work. Thank you. And I wanted to read one of the better surveys that we got. It says, the nurse came into my room and put some medication into my IV. She then looked up at me and asked me, wait, what's your name? And I told her my name. And then she said, uh-oh, and ran out of the room and never came back. But I had the best sleep of my life that night. Nice. Good job, guys. Thank you. Okay, so remember, if it's your turn to get report from Janet, don't forget to log your name in the Janet Report logbook so we won't get you 2 weeks in a row. And don't forget that you need to call your family and say, hey, I'm going to be late. Okay? Thank you. Let's go to the suggestion box. Okay. This says, Boost does not work as coffee creamer. That's true. It looks creamy and delicious like it would work, but it doesn't. It's disgusting. All right. Well, you guys have a great shift. Just know that we are having 2 nurses work as techs tonight, so you're probably not going to get your vitals or your blood sugars until about 1 a.m. Okay, is this everybody? Let's go ahead and get started, okay? Okay, first things first. Guys, we've got to start staggering our lunch breaks, okay? Because I'm pretty sure you all went to lunch at the exact same time last night. And I was all by myself out here. I couldn't get a hold of anybody. Okay, there were 17 call lights going off. The dude in 403, he started answering them, okay? It was crazy. He took 412 to the bathroom twice. I didn't even try to stop him. He was doing such a good job. It's crazy. Thank you. Janet, 406, does not want you to be his nurse tonight. He said that he kept pretending to sleep last night so that he wouldn't have to have conversations with you. Okay, but he said while you thought he was asleep, you were farting. He said he heard you fart 8 or 9 times, and then he heard after each one you would go, And you said after one, you said, whoa, that was a wet one. So I'll be taking him tonight, okay? Thank you. Let's go to the suggestion box. This one says, I have a great idea for an invention. It's for a bed for incontinent patients where there's just a hole cut in the middle with a bucket underneath that they can put their bottom in. It's a pretty good idea, actually. I guess we could call it the butthole bed. All right, well, you guys have a great shift. Just know that we have been giving expired milk to patients for like the past 3 days, so I guess we'll see what happens with that.